Hi, I'm Dr. Hagmeyer, and if you've been diagnosed with small intestinal bacterial overgrowth, otherwise known as SIBO, then without a doubt this is a pretty big frustration, and dealing with bloating and gas and constipation and diarrhea on a regular basis is probably getting pretty old. And so I want to talk to you and give you some insight into a very important key area that you should be aware of that might be one of the missing pieces in your quest to overcoming methane dominant SIBO or IBS constipation. This piece of the puzzle is known as a prokinetic. And so what is a prokinetic? What do they do? Why are they important? Who should take them? Okay, these are the things we're going to be discussing in today's video. But prokinetics are drugs or herbal compounds that cause strong contractions and emptying of either the stomach contents or the intestinal contents, meaning the small intestines. And what they essentially do is they stimulate the migrating motor complex, which are the cleansing waves that basically are activated between meals or during fasting states. Okay, I like to think of this migrating motor complex as really as the intestinal sweepers of our body. They literally are sweeping debris, they're sweeping bacteria, they're sweeping things along the GI tract. And so this intestinal motility issue can get off track for a number of reasons. Sometimes it's the immune system attacks certain nerve cells which control motility. This is what we call autoimmune IBS, which we're seeing more and more common through the testing and the research that's been done looking at antibodies against a very special protein called vinculin. But motility can also get off to a bad start for many other reasons. Again, perhaps the migrating motor complex is contracting not as strong as it should be, or it's not contracting as frequently as it should be. Or they don't occur at the right time, or they don't last as long. So there's a lot of different potential scenarios that are occurring there. But whatever the reason, people that suffer with constipation or methane dominant SIBO will find that the addition of a prokinetic can be one of the greatest things in resetting the migrating motor complex. So what's the connection between the migrating motor complex and SIBO, right? Well, people who have IBS-C, again, that constipation dominant irritable bowel syndrome, or even those patients who have IBS-M, which is mixed. Okay, these are the patients who have diarrhea and constipation. Okay, but if you're that kind of IBS sufferer, and let's say you ran a SIBO breath test and your SIBO breath test came back positive for methane, this is a classic example of how prokinetics can be very beneficial to you and advantageous to you. If your body is unable to move food, if it's unable to move waste, if it's unable to move bacteria down and out, essentially what we're going to end up with is a problem with the ileocecal valve. Okay, then the bacteria and the parasite and the co-infection develops, it grows, we get this bacterial overgrowth process that develops. So two things that are very important is anytime we slow down the migrating motor complex, we slow it down or it becomes dysregulated, you are essentially slowing down that sweeping cleansing action, which again is such an integral part of gastrointestinal health and also immune system health. Okay, so one thing you may want to start doing is in order to lighten up the load, so to speak, on the MMC is follow a low FODMAP diet. That would be one thing that I think is very important. The other thing I think is very important is eating smaller meals. And then finally, of course, is spacing those smaller meals further out throughout the day. So if you're, let's say, a person who kind of eats throughout the day and you're kind of a grazer, you eat while you work, but you nibble all day long, that's not a good thing when you have SIBO, okay? What else can you do if you have problems or you find out that there's an issue with this migrating motor complex? And again, that's the purpose of today's video. The key here is supplementing with prokinetics. So earlier we talked about what a prokinetic is and why they're important and how they can help. One other thing I want you to keep in mind is that there's many different kinds of prokinetics, and I usually recommend that patients start out with, of course, the more natural ones first, then resort to the drug-based prokinetics like erythromycin and some other ones that we'll talk about today. Unfortunately, what happens is I see too many doctors that jump all in and using the drug-based prokinetics as a first line of defense, when there are many things that naturally, if we take the time to really investigate a patient's case, that can be very advantageous to that patient. So a couple of things that are worth mentioning when it comes to prokinetics. Number one is you want to take your prokinetic at night before bed. And depending on the person and the severity of methane, you can take them all throughout the day. But the key here is take them between meals or right before bed. Number two that I often suggest is that you rotate the kind of prokinetic that you're using. And that's really ultimately, in my experience, what I've noticed is it just tends to be more effective that way, okay? Some of the prokinetics that I think work best in my experience are going to be things like 5-HTP. You may have heard of 5-HTP in the sense that some people use it to help them sleep. But 5-HTP, the benefit of 5-HTP is that it's a precursor to serotonin. And we know, and this is something I talk about with patients all the time, and why I think it's important to test for things like amino acids, the precursors to many of the neurotransmitters. But again, because 5-HTP is a precursor to serotonin, we know that serotonin has a direct impact on the nerves that affect gastrointestinal motility, all right? Too little serotonin and we have things like constipation. But on the flip side of that, when we have too much serotonin, we often have diarrhea, okay? So the thing to understand about, and I should say this is more like a word of caution, is that when it comes to 5-HTP, the reality is that many people who suffer with irritable bowel syndrome also suffer with things like anxiety and depression. And maybe perhaps if you're out there and you're watching this video and you suffer with anxiety and depression, maybe you're already taking a drug like an SSRI. This is the one scenario where I really suggest that you exercise caution or be sure to be working with a doctor who understands that and is not afraid to kind of walk you through that process, because it can be quite scary if things go off in the wrong direction, okay? So again, just be very, very careful when you supplement with something like 5-HTP. Again, it does have the ability to increase your serotonin levels, and of course, there's tons of benefits that come to improving serotonin levels when we're talking about an issue where anxiety and constipation and depression is one of the factors, okay? But again, I don't suggest this unless it's under the guidance of a doctor. Another natural prokinetic that you could be aware of, that you should be aware of, and something that's very easy to use and implement, you don't have to worry about problems with it, is something called ginger, right? You can drink ginger tea, but I also suggest that you take it as a supplement. I tell patients how to make ginger tea. It's super easy. If you don't know how to make it, it's as simple as cutting off a chunk of ginger, slicing it like with a carrot slicer, throwing it into a pot of boiling water, and basically boiling it for 10 minutes, and that's it, right? That's how simple it really is. And it's super cheap. It's super easy to do. Get nice, good quality ginger, okay? And so again, ginger's a real easy, another option there that you can implement for the purpose of those prokinetics. Another prokinetic that I like that I use quite often is Triphala, okay? Triphala is an Indian herb. It's Indian fruit rather, and it's herb fruit, but it's made up of really 3 fruits, okay? And so what I like about it is that not only is it very powerful in terms of being a prokinetic, Triphala also has properties that are bacteriostatic. They're antiviral. It has antioxidants. It has anti-tumor benefits to it. It acts as an adaptogenic herb as well. So there's a lot of benefits there. In fact, in one study, when researchers compared the effects of Triphala to prokinetic drugs, what they found was that Triphala increased gastric emptying by 86% compared to 76% of metochlopramide, okay? And so again, when you look at the effects of, let's say, a drug versus something that is natural, 76% versus 86%. So again, why not use something that's natural, something that's free of side effects? And for many people, it's really a fantastic prokinetic and useful alternative in the world of prokinetics when you need them, okay? One of my favorite minerals that also helps with motility issues, of course, is magnesium, okay? Magnesium is involved in over 300 bodily enzymes and over 300 bodily enzymatic reactions occurring in the body are dependent upon magnesium. Magnesium deficiencies are very, very common. And again, when we look at how involved, all the different enzyme reactions that magnesium is involved in, it's pretty suggestive that, a magnesium deficiency, when it exists, a person taking magnesium can have tremendous benefit from it, okay? Magnesium from a neurological standpoint is very important because it helps balance out the 2 different kinds of nerve systems, the sympathetic branch of the nerve system and the parasympathetic branch of the nerve system. You may remember in another video we talked about the vagus nerve, and we talked about it being one of the most important parasympathetic nerves in the body. Well, one of the things that that nerve requires is magnesium, okay? In order for us to maintain good, healthy, normal vagal tone, magnesium is needed, right? So again, if you watch the video that we did talking about the vagal exercises that can help stimulate the migrating motor complex, can help stimulate the parasympathetic branch of the nerve system, again, magnesium is very helpful there. So point here is that there's many, many different kinds of prokinetics that it would be impossible for me to go over all of them, but those are my favorites, okay? One of the questions that I was asked the other day, and I thought this was a fabulous question, was the question that essentially was, if a person is taking prokinetic, can you take a prokinetic if you have diarrhea, right? If you have IBS-D, so IBS diarrhea, IBS-dominated diarrhea. And the answer to that, of course, is you can take it, and very often it is recommended that you take it, because again, you know, when we talk about SIBO, it's important to keep in mind that SIBO is due to the overgrowth of bacteria living in the small intestines, not by too much motility. Okay, so it's not that the motility is the problem; it's the overgrowth and the kind of overgrowth and the types of bacteria associated with the overgrowth. You know, typically hydrogen-dominated bacteria that are causing the motility issue, or causing excessive motility issue here. So the key here is if we fix the overgrowth issue, the motility issue should actually correct itself. Okay, so there are 5 final thoughts that I want to leave you with today, with today's video. Is number 1, if you seem to be making slow progress with your gastrointestinal issues, it may be time to start thinking about a prokinetic and things that you can do to improve the migrating motor complex. There's a 3-part video series that I talk about that migrating motor complex and some of the pitfalls that occur with SIBO as it relates to the migrating motor complex. So again, check that out. Number 2 is if your migrating motor complex is unable to move food along and it's unable to move waste out appropriately, chances are we're going to have that overgrowth of bacteria that develop as well. So again, support that migrating motor complex. Number 3, take your prokinetics before bed, rotate them, and then of course, if you're not finding much of an improvement there, what I suggest is that you do is you take them between meals as well. So some people can benefit just by taking them once a day. Some people, depending on the levels of hydrogen or methane, depending on the case that you're dealing with, again, you can take them between meals, 2 or 3 or 4 times a day as well, okay? Number 4, a slow migrating motor complex is usually due to methane, while a rapid migrating motor complex is associated with hydrogen-dominant SIBO. And number 5, I also suggest that you watch the video I did on manual manipulation of the ileocecal valve. Okay, this video will show you the who, what, where, when, and why of this valve, why it's important, and how you can do it at home. You can do it at home with either by yourself or, if better, if you have a spouse or a loved one, they can help you do that as well. So I hope you liked today's video. Also, one thing I want to throw out there is if there's a topic on SIBO that you want to know more about that you don't find in this particular video series, be sure to leave us a comment below. And of course, if we get enough interest in that topic, you know, without a doubt, I'll want to shoot some information on that. So again, until next time, I hope you enjoyed today's video. Take care.